Understanding the proposed diagnostic criteria for fear of harm gets us only part of the way to an accurate diagnosis. Our final topic in this series addresses a practical concern parents and practitioners have. How can we test for fear of harm? In addition to an in-person assessment by a qualified mental health care provider, there are several tools that can be used to help with the process of diagnosing. The first is a tool that can be used by parents to gather data about their child's condition. It's called the Child Bipolar Questionnaire, or the CBQ for short. The CBQ is a survey that provides reliable information about the presence of early onset bipolar disorder. It's simple to use and has provided data from close to 20,000 children who were either diagnosed with or at risk for bipolar disorder. This 65-question test collects information not only on the symptoms of bipolar disorder, but also on other disorders that often exist at the same time, such as mania, major depression, separation anxiety, generalized anxiety disorder, obsessive compulsive disorder, oppositional defiant disorder, conduct disorder, and attention deficit disorder. Another factor that makes the CBQ helpful is that instead of only asking if a symptom or behavior is present or not, the CBQ asks for these experiences to be reported in terms of how significant or severe they are. Each question's response is rated on a scale based on frequency of occurrence, with 1 for never or hardly ever, 2 for sometimes, 3 for often, and 4 for very often or almost constantly. The CBQ and its scoring system has been rigorously tested and has been shown to be extremely valid, including in cross-cultural validations. It's also very reliable. The CBQ can identify with 96% accuracy the presence of fear of harm, and best of all, the CBQ requires less than 20 minutes to fill out, and it can be completed at home by parents and caregivers without the need for a professional to administer the test. The second testing tool is called the Janie and Jeffrey Illustrated Interview for Children, otherwise known as the JJ. It's a companion to the CBQ that can be completed by the child. In fact, it is the first assessment tool for bipolar disorder ever designed specifically for children. The JJ has comic strip style illustrations that engage the child's interest while making him or her feel comfortable and safe enough to answer the questions honestly. Each question is illustrated with pictures designed to allow the child to understand and express a symptom or behavior without having to use words. Through the child's responses to the various illustrations, the psychiatrist, therapist, and parent are able to gain insight into the child's experience of the world. Being able to share all of this makes the child feel less isolated and less alone. This encourages the child to talk about moods, fears, hallucinations, and even possible suicidal thoughts that they may be unwilling to talk about with the adults around them. Most importantly, the completed JJ gives specific information about how the symptoms affect each child so that the treatment can be tailored to each child's feelings, fears, and behaviors. And like the CBQ, the JJ is quick and easy to fill out, taking approximately 15 minutes for the child to complete. If you'd like to complete the CBQ and JJ surveys, you can find a link on the Children's Mental Health Resource Center website that will take you to the CBQ portal where you can register, access the CBQ and JJ, and have the option to submit them for scoring. The third testing tool is actually a series of short assessments, each of which focuses on a specific symptom cluster in fear of harm. These quizzes examine body temperature issues, sleep disruptions, and aggressive behaviors. Once all of these assessments have been completed, you'll need a mental health professional to help you understand, interpret, and make use of the results. This leads to the fourth testing tool, which is actually a clinical interview with a qualified mental health professional, who understands fear of harm and its complex presentation. Patients and parents prepare for this clinical interview by providing a written history of mood instability, medication trials and their outcomes, as well as psychosocial factors that impact daily functioning. Finding professionals who are truly qualified to recognize fear of harm can be difficult, and many families find that it's difficult to get an accurate diagnosis and effective treatment without additional support. This is where CMHRC's diagnostic consulting, community advocacy, and support services prove to be so essential. Through the CMHRC Diagnostic Consultation Service, you'll complete the required assessments and patient history. Then, you'll meet with CMHRC mental health staff who review all of the results with you. We'll provide you with the written results of all of your testing and make sure you understand the results. We'll also include relevant research data to support the testing outcomes and prepare you to advocate on your own or on your child's behalf. Our community advocates will do outreach to your current providers to explain your assessment results and to advocate for the treatment that has been researched and outlined as best practices for fear of harm. Through our support services, we'll also get you connected with our support groups and the CMHRC community of families who are walking with you on this path to stability. With these tools and help from the Children's Mental Health Resource Center, you'll be able to get the answers and information about fear of harm that you need. In our next video, we'll talk about biomarkers. What are they, and why do they matter?